Hey, this is Dr. Mark Richard, orthopedic surgeon at Duke University. And today on Diamond Doc, we're going to answer some mailbag questions about options for UCL injuries of the elbow in young players. The first question asks, is there any data or research on the effects of using PRP with a repair or replacement? Great question. To review, PRP is platelet-rich plasma. It is a concentration of a particular type of cell known as a platelet, which circulates in the blood. The platelets and the plasma portion of the blood contain many important factors that promote healing. In this procedure, blood is drawn from the patient and centrifuged to separate it into its component parts. The platelet-rich plasma is then delivered back at the site of injury, usually under ultrasound guidance, to deliver the healing factors where they are needed. We are still not entirely sure how PRP works. Basic science studies show that PRP may improve healing in certain tissues, but clinical studies are relatively lacking. A few studies have looked at the use of PRP for UCL injuries of the elbow in throwing athletes. One group looked at partial UCL tears treated with PRP injection and found that 88% of the players returned to the same level of competition with no complaints at just over a year out from the injury. The average time to return to sport was 3 months. Another group looked at their experience with PRP for the treatment of UCL injuries in pitchers. They found that 73% of players had good to excellent outcomes and that players were similarly able to return to competition at a mean of 3 months. Overall, outcomes were better for patients receiving PRP than the historical outcomes for standard non-operative management without PRP. So in summary, PRP has demonstrated some promise, but more information is needed to understand its overall role in treatment. One other mailbag question from last time asks, do you think UCL tears are from overuse and pitching too much, or not enough throwing and having weaker throwing muscles? Thanks for this important question as well. The causes of UCL tears in throwers are multifactorial. We definitely don't have it all figured out, partly because there are many contributing factors, which makes it complicated. Certainly, there are technique issues that contribute to increased stress at the elbow. Remember that throwing a baseball is a delicate balance of forces moving from the larger muscles sequentially to the smaller ones. If there are imbalances along the way, this can result in increased stress at the UCL. More importantly, we know that there is a link between pitching too much and elbow injury. Pitching volume is not only measured by too many throws in a game or too few days of rest between outings. Pitching too much is also measured by the number of months that you throw per year. Youth pitchers who throw more than 8 months per year have 5 times the risk of shoulder and elbow injury than those who throw less than 8 months. And those who regularly throw with pain have 36 times the risk of such an injury. So know your pitch smart guidelines and stay healthy. Do you have other questions about UCL injury? Please respond in the comments and ask your questions using the hashtag USABmailbag.